Hi there! Today we'll be discussing some misconceptions of genetic testing presented to you by Jay, Jasmine, and Ellen. So the question is genetic testing 100% reliable?
We will first go over what genetic testing is before tackling the misconception. What is genetic testing? Genetic testing is a type of medical test that is used to identify changes and mutations in chromosomes, genes, or proteins. Results from this test can confirm or rule out a suspected genetic condition of the individual tested, or help determine a person's chance of developing or passing on a genetic disorder. The procedure usually involves a range of tests on DNA samples collected through blood, saliva, skin, hair, amniotic fluid, and other several factors. Currently, there are more than 2,000 genetic tests that are in use and under development as well.
There are several different types and procedures of genetic testing that are provided by genetic counselors today to concerned families. However, throughout this video, we will be addressing the two most common procedures that concerned families refer to today.
Newborn screening is the practice of testing every newborn for certain harmful or potentially fatal disorders. It detects whether newborns will have conditions that can eventually cause problems later in their lifespan. Prenatal screening is used to detect changes in a fetus's genes and chromosomes before birth. It looks for any signs of infection and whether you are immune to certain pathological diseases such as chickenpox and rubella. Unfortunately, even if healthcare professionals today have provided different ways to genetic testing and diagnose individuals with certain pathologies, the previously outlined tests are not deemed to be 100% accurate. Although newborn screening is utilized by 4 million newborns every year in America, newborn screening presents concerns regarding its accuracy. According to Dr. Philip M. Farrell from the University of Wisconsin, approximately 1 in 50 of every positive newborn screening test detects actual disease. Therefore, newborn screening are prone to a high rate of false positives. He also says that on average, for every 10 positive screening tests for cystic fibrosis, only one child may actually have the disease. Moreover, according to a meta-analysis review conducted by Thompson et al., approximately 2,041 to 2,794 low-risk and 86 to 208 high-risk newborns were screened with a positive predictive value of merely 6.7%. 6 to 15% were missed and were diagnosed with bilateral permanent hearing loss, or PHL.
Prenatal screening also presents with a significant amount of evidence pertaining to a lack of accuracy. According to a systematic review by Phillips et al. In 2015, the purpose of the study was to measure the accuracy of non-invasive prenatal procedures for 3 diseases: Downs, Edwards, and Patau syndromes. Results showed that although overall sensitivity for all 3 diseases was greater than 90%, approximately 150 out of 100,000 pregnancies were determined as false positives. The study concluded that it should not be used as a final diagnosis for positive cases, despite the considerable accuracy of the screening. Overall, the belief that genetic testing is 100% accurate is a common misconception within healthcare today. Although the purpose of genetic testing serves a positive functionality, the consequences generated from the inaccuracy can create more obstacles and problems for concerned families today.